This is Chad Utterson. Hi, this is Chad Utterson, and we're discussing health information exchanges. Health Information Exchange, or HIE, is a way for healthcare providers to share information on a patient. It allows healthcare organizations to view medical records from other providers. It also allows for providers to view laboratory values, medications prescribed, allergies, or other prevalent information related to the patient. The idea of sharing patient information should hopefully decrease the number of repeat tests and save money. It also has the promise of treating a patient's medical issues better. The hope is that with a health information exchange, patients can avoid a hospital admission, medication-related errors, improve diagnosis, and avoid repeating lab tests. It hopefully can also decrease the amount of paperwork and faxing of medical information and improve reporting to public health departments. The idea of medical information exchange started with the initiation of the HITECH, or Health Information Technology for Economic and Clinical Health Act, which was passed in 2009. Since the start of HITECH, many vendors have pushed their product to help providers easily find information about their patients. Patients could query a database to see if their patient had information stored in the database to help them care for the patient. Unfortunately, this is not a free venture. There's a cost associated with the use of the HIE. The HIE organization usually has a membership cost to use and upload to the system. HIE can operate either as a public or private health information exchange. First, a private HIE is more likely to be utilized by two different integrated networks or two different large hospitals. Private HIEs frequently carry 501c3 status, which can significantly decrease the amount of taxes they pay. And as they are usually only working with two different networks, the cost to operate can be less. Public HIEs are typically region-based and can have a great number of providers submitting and querying medical information. Because of the size and the workload, public HIE can be quite expensive to run when compared to a private HIE. Capabilities. HIE can be a direct exchange, a query-based exchange, or an exchange that is driven by the patient. A direct exchange, the sharing of information about a patient in between providers. For instance, if a specialist sees a patient, they can send their reviews of the patient recommendation or treatments to the primary care provider so they can be familiar with their care and can be overseeing all aspects of the patient's care. The query-based exchange is when a provider queries whether a patient has information stored on the exchange. Maybe a patient arrives in the emergency department or at an urgent care facility, and the provider wishes to see the patient's problem list or medications. This is a situation that could greatly assist the provider. It is not uncommon for a patient to not know or fully know their medications and what they are used for. Also, a patient could leave off a certain piece of their medical history, which could significantly impact the care they could receive today. Overall, the system can contain a plethora of medical information about each patient. Another function of HIE is that of reporting. Utilizing direct exchange, certain information is transmitted to the Centers for Medicare and Medicaid Services and to public health departments. The importance of this information can assist public health departments in seeing trends in disease outbreaks or trends in medical diagnosis in a certain community. This can assist the community as a whole when there is a disease outbreak. It can be noted by public health before individual providers might notice this trend. The most common registries for public health are immunizations, birth defects, and cancer rates, but they also look at the number of asthmatics, diabetics, HIV or AIDS, autism, and lead levels in the population. There are several issues related to the capabilities surrounding HIE. First, it is related to how many of the systems or healthcare organizations that are actually using the health information exchange. It can relate to finding the application information on the patient in an HIE. Not all medical centers or patients have enrolled on HIE or health information exchange, which can make things more difficult. Some have cited issues related to HIPAA or the Health Insurance Portability and Accountability Act as a fear for not sharing patient information. Information standards. One main area of issue with health information exchange and electronic health records as a whole revolves around the topic of interoperability. Interoperability is the ability of one computer network to talk and understand another. The Office of the National Coordinator for Health Information Technology, or the ONC, is tasked with helping interoperability succeed in the medical technology world. ONC has identified 16 different elements, or as they call it, the Common Meaningful Use Data Set, that are integral for interoperability to succeed in the medical world. Several are related to demographics, such as name, sex, date of birth, race, ethnicity, and language. Then several are more related to the medical issues, such as allergies, medications, problem lists, laboratory values, procedures performed, smoking, and vital signs. It is imperative that when a provider queries the database, they are able to see these important elements. Along with meaningful use data sets, the ONC suggested 5 different areas were also deemed to be imperative to be addressed. This consists of vocabulary and code sets, transport, services, security, and content structure. The vocabulary or code sets consisted of standard terms for different medical issues, such as procedures, medical problems, or diagnoses. Content structure refers to how the information is transmitted to the digital environment. This topic is beyond the scope of this class. Transport relates to how the patient information is moved to the HIE and helps assure that the information is transported securely. It is imperative that an HIE service provider in the transmission of healthcare data follow the HIPAA or the Health Insurance Portability and Accountability Act, which maintains privacy for the patient. Participation barriers. Unfortunately, HIE has not taken off in the medical community as many would have hoped. There are several issues or barriers that can help explain why. One variable is the issue with patient consent to having their data transmitted to an HIE. The consent requirements vary between federal and state law, and this presents a challenge to providers. Another barrier for providers is the cost they incur with the involvement in an HIE. It might mean that they have better information at their fingertips, but it still costs them money to subscribe to an HIE. The cost is usually quite significant if a medical facility already has an electronic health record in place already. The EHR vendor can charge enormous fees for this process. Another barrier to the growth of HIE, especially public HIE, is the government red tape and stringent regulations when compared to that of the private HIEs. Also deemed as a barrier is the cost associated with public health information exchanges. Again, much more expensive than when compared to a private HIE. The technology in a public HIE is also significantly behind that of most private health information exchanges. Even if a medical facility or provider has access to HIE, this does not mean it will get used. Issues have been brought up on the ability for a provider to find the information they are looking for and to accomplish this in a relatively short amount of time. Some users feel that accessing and finding the data is not intuitive and that it had to be more of a hindrance rather than assisting the provider. Recommendations. HIE should have the ability to assist providers in caring for their patients. It should decrease healthcare costs, decrease the number of unnecessary or repetitive tests, improve patient care, and overall improve the healthcare system. It has yet to do all this. The first thing that needs to be addressed is interoperability. This is where government leaders need to step in to assure that interoperability is being addressed and addressed correctly. It is also necessary that vendors of different EHRs and HIEs are at the table during these discussions. The costs associated with running and belonging to a health information exchange can be difficult to maintain or join. Somehow these costs need to be addressed so that even small practices will be able to join and share in the information. As more and more providers see the benefits of a new and improved health information exchange, the patients will be the ones who benefit. Then it will be the patients who will demand that the providers use a health information exchange. There are many factors that play into the future success of health information exchange in the United States. Government influence is a needed step to assure the advancement of HIE, especially with regard to interoperability and possible cost. Vendors need to address the concerns of users related to the usability or ease of use. The use and storage of pertinent medical information on health information exchanges has many benefits, and it is past time to assure that medical care in the United States not fall behind, but lead on this important issue.